Good afternoon, everyone, and welcome to today's webinar hosted by TrueLearn. To actively participate in today's event, you can use the chat feature located on the right-hand side of your screen, as well as weigh in using the polls as they appear below. We encourage our viewers to ask any questions for today's presenter by typing them into the question pane located at the bottom of the screen, in which we will collect all of the questions and address them during the Q&A portion at the end of the session. I would now like to introduce our presenter, Ramya Iyer, psychotherapist and founder of Thriving in Residency, a self-care course designed to provide psychological context for the very real emotional challenges of practicing medicine while helping residents and medical students develop self-reflective skills to track and manage their mood. Let's give her a warm welcome or a hello in the chat box. Thank you so much for being with us today.
Hi, thank you for having me. I'm Ramya Iyer, and I'm a psychotherapist and the founder of Thriving in Residency here in Chicago. So this presentation is going to be on burnout and trauma in medicine. So it's going to be broken down into three sections. The first is going to be on burnout and defining what exactly burnout is, and then understanding its impact. The second will be on post-traumatic stress in medicine and the psychological impact of practicing medicine on the mind. And the third will be an application section that's going to really focus on exercises and strategies to manage symptoms of trauma and the experience of burnout. So let's get started. First, we'll start with burnout here. So let's think about why we feel burned out. So I would argue that the characteristics that make somebody a good physician or medical provider also make them quite vulnerable to getting burned out. And this is because often people in helping professions tend to be compassionate and empathetic, tend to be very detail-oriented and perfectionistic, and of course, very hardworking. Also, people in the medical profession tend to delay gratification. And we see this, or I see it a lot in my patients who tend to put off marriage or having kids, buying homes, because they're busy training to do some really important work in the world. Meanwhile, their peers are sort of moving forward. This affects motivation, and it affects how people feel about the practice of medicine. Also, I find that clinical learning environments can be very disempowering. So where somebody is in the medical structure that they're working in can really impact how much, they can impact clinical decisions and how much agency they feel in that system. This can also touch on sort of deeper struggles around imposter syndrome because you're surrounded by people who are very high functioning. So it can touch on our own insecurities at times. However, all of you are extremely qualified and are exactly where you should be. Otherwise, you wouldn't have gotten in. But these are very normal and common feelings that I hear a lot from patients. And this does impact this sort of overall feeling of burnout. The last piece I want to touch on here is this idea that, so you spend a lot of time doing scut work. So things that are not that sort of emotionally engaging, like charting, pre-authorizations, and sort of training module. And all of these things are very important and a huge part of being a medical provider. However, it does take away from meaningful learning interactions or patient interactions, or even connections with peers and colleagues. I find that these three factors together are highly reported and a big part of what causes burnout. So I think that it makes it sometimes difficult to maintain empathy and human connection in the work when you're sort of coping with all of these things. But starting to acknowledge that this is happening, and throughout this presentation, we'll talk about the importance of acknowledging so that we can learn how to manage this. So burnout, of course, doesn't happen in a vacuum. As you know, practicing medicine isn't always glamorous and it's not always rewarding. Although there's shows like ER and Grey's Anatomy, the actual work is quite hard and rigorous. There are, of course, times when you're going to feel engaged and motivated. And like any profession, there are going to be times when you're overwhelmed and exhausted and really questioning why you chose this profession. I'm stating this here because I think that's a really normal question to have. And I think most physicians wonder why they're doing what they're doing. treating patients, I think you're navigating multiple relationships in a hospital system or in any medical system, not only the relationships with your patients, but with colleagues and peers, and the larger sort of healthcare system at large. And that can also be frustrating and challenging and really impact sort of motivation. So I think any human being would feel really overwhelmed and burdened by all of this. So when you're feeling demotivated, I think what can be helpful is to ask yourself, more deeply, what brought you into medicine? Why did you choose this field? And remind yourself of the parts of the profession that you do love, or ground yourself in the deeper meaning of the work. And sometimes it's easy to lose sight of that with all the things you're managing, but I think tuning back into that can be very helpful. So, Christina Maslach, who researches burnout, sort of breaks it down into three sections, and I'm going to touch on these three. The first is emotional exhaustion. And the second is this feeling of depersonalization, or sort of feeling very distant and almost robotic. And the last one is a sort of a decrease in sort of diminished personal accomplishment, or not feeling effective or capable in some way. And so these three dimensions are important for us to really understand what burnout is and where we fall in that. Starting with emotional exhaustion, feeling emotionally sort of overextended and just depleted of your resources. And this can affect how we communicate with ourselves, but also our patients and colleagues, superiors. So it's really when your sort of emotional bank account feels empty. This does differ from physical exhaustion, but I think often those two get mixed up together. And of course, they influence each other. But sometimes emotional exhaustion can really show up somatically, or sort of in your body, with feeling very tired. So it's something to really pay attention to. And you can notice this if, let's say, you got a really good night's rest and yet you still kind of wake up feeling exhausted. That could be an indication that it's actually your emotional bank account that's empty and not as much of a physical problem. This can at times overlap with the feeling of numbness, and we're going to talk more about why that happens down the road. But really, we want to pay attention to this. I mean, everybody experiences it, but it's really when something is prolonged or sustained that it can impact your connection with the work. Next, to touch on depersonalization. Depersonalization in medicine seems to be sort of really thinking about patients as objects. Objectification is really common, I think, in medicine in the world, but it's really a response to stress. And it's a response to high acuity, high volume of patients. So you can't think of every person as a person. It's sort of your brain starts to break it down. And it's really common to refer to patients by their diagnoses and not necessarily by the person. Now, this is, I think, normal and okay, but it's really more of a problem when you're having difficulty connecting with the other and seeing them as separate. And we're going to talk more about how depersonalization and trauma come together, because I think that'll clarify this more deeply. The last one I'm going to touch on for burnout is diminished personal accomplishment. So again, what makes you a really good medical provider can also make you kind of vulnerable to burnout, because your access to your own sort of empathy and human connection sometimes can overwhelm. Again, clinical learning environments can be very disempowering, and there are a lot of systemic issues that we know you're navigating on a daily basis. You may spend a lot of time on tasks that just aren't that interesting or engaging, and this again affects engagement. So, all of this, you may leave a shift feeling like you haven't achieved as much as you would like, or you haven't gotten what you really would like to get out of the work. And these are moments, these things come together to sort of impact how accomplished you feel, how capable you feel as a physician, and how much meaning you're able to derive from the work. So just to summarize burnout, you know, I talk about depersonalization, diminished personal accomplishment, and emotional exhaustion. And I think it's important that, we recognize these categories, because experiencing any one dimension of burnout for a long period of time is going to interfere with your ability to connect and derive meaning. This ability to connect and derive meaning sort of from providing care is really important because it really mitigates the long-term impact of burnout. So you want to get connected to the work again. And understanding these dimensions and sort of being aware of sort of what kind of burnout you're experiencing is going to help you learn how to address the negative effects or impact of the experience, and then help you get re-engaged with your work and really find ways to enjoy it again. So, I'm going to talk next about the relationship between burnout and post-traumatic stress. So, in medicine, the reality is that you are repeatedly exposed to death and at times human suffering, and psychological and physical traumas. Sort of this repeated exposure can cause sort of a split in the mind, between our mind and our body and emotions. And this is part of what causes that robotic, distant, or numb feeling. So depersonalization is one dimension of burnout, but it is also a larger psychological concept, and it's a reaction to the experience of post-traumatic stress. Depersonalization tends to occur when we have traumatic experiences that we don't really recognize. So if we're not really aware of the impact of those experiences, then our mind starts to sort of distance and split, and we feel more numb. And then so not recognizing it makes it harder to manage. And that's why I really emphasize noticing what's going on in your mind and your body and how you're reacting to the work. So let's learn about, what post-traumatic stress looks like in medicine. So this section is going to be on trauma. So I'm going to introduce trauma as I see it. Post-traumatic stress, trauma is a negatively perceived event, action, or condition that damages, disrupts, distorts, destroys, or changes in some fundamental way a person's sense of self, their relationships, and/or environment. And this experience also requires some level of neurophysiological arousal. Okay? So what is the impact of trauma in medicine? So this is saying that life-threatening events are going to be traumatic to any human mind. So we tend to feel unsafe both consciously at times and also unconsciously when we're having life-threatening events. And this affects our interactions with others and how we think about ourselves. And preventing physical harm and death is, integral to your work, right? So that means that on some level, you're always working to prevent the worst case scenario. You're likely experiencing some amount of trauma on a day-to-day basis. And acknowledging that that's happening is going to help us explore ways to manage those reactions and help you function better and feel more engaged in your work. So developing self-reflective and practical skills is going to help you sort of stay calm and increase your sense of fulfillment. So I'm going to start just, with flight, fight, freeze, because this is really what everybody knows. So it's really normal for the sympathetic nervous system to respond to increased arousal in the environment. And we think of this physiological and psychological response as fight, flight, or freeze. It usually shows up in one of these ways. Traumatic responses tend to have a range, and they can emerge in many different forms for different people. The goal really here is to reflect and catch these thoughts and feelings early on and respond appropriately in clinical and professional and personal settings. So what are features of traumatic responses? I'm going to focus on 3 today. The re-experiencing of the event, avoidance of the event, and hyperarousal. So when we're re-experiencing an event, we experience a traumatic event, and like patient loss or witnessing medical trauma, it stays in our minds and bodies and can re-emerge at random. They're cognitive and sensory experiences like intrusive thoughts or memories, images, and perceptions. There can be sleep disturbance. So that could be like reoccurring or distressing dreams. It can be so sometimes difficulty falling asleep because your mind is racing, or difficulty, waking up, sort of oversleeping. There can be, of course, physiological responses like, if you're walking through the hospital and all of a sudden your heart rate increases, increased sort of breathing or sweating, muscle tension, feeling kind of sometimes dizzy. Sometimes these are reactions to some post-traumatic stress. So it's common to start avoiding because, right, you're in a hyper aroused state. There's a lot going on in the body and mind. So people start avoiding the stimuli. And this can look like in medicine, I often hear like if somebody witnesses a medical trauma or they have, let's say, a really conflictual engagement with a peer or colleague, they may start avoiding that person or that room where the trauma happened. They may start avoiding certain conversations or feelings. You can also start avoiding sort of places and people. Um, and this can, I think it's really common to avoid when we're feeling overstimulated, but it can really affect our, ability to recall important information. And there can be a detachment and sort of, as a result, a restricted range of emotions. Like we can't experience all of our feelings very well. To sort of go back to avoidance or tie it up, see, these forms of avoidance are very common for all people. But I think they show up a lot in medicine because of the high acuity and volume and the level of stress that you're dealing with. Avoiding can be adaptive, it can restore functioning in the short term. However, sometimes there can be long term negative effects, like on our relationships and sometimes on professional development. And one strategy to regain a sense of control is to also build self awareness and insight, sort of know when you're triggered, know when you're having re experiencing, having intrusive thoughts or images or emotional memories. And notice when you're starting to become anxious and sort of heightened. And noticing that can help you learn strategies to manage that so that avoidance isn't the only option. So what I just described really is a state of hyperarousal, right? So when we experience a trigger, like say sometimes people walk into the hospital and the smell of the hospital will stir up a whole bunch of memories or thoughts. Our bodies and minds are starting to react to the environment. And this can appear in different ways, but one of the ways most common is our flashbacks or images or thoughts that sort of intrude in your mind and affect how you're able to think and function. And unfortunately, they kind of come up randomly usually. The physiological responses to track are increased heart rate or blood pressure, sweating, and sort of elevated cortisol. Um, And to review, so the three sort of things that we really touched on with trauma is this re-experiencing, avoidance, and hyperarousal. It's really likely that all of you have experienced some of these or all of them and at different points in your career. They occur a lot in medicine because, again, to sort of bring this back up, you are dealing with life and death, and that's very important work. But that also means that, you're going to be exposed to these things. And as a result, your bodies and minds are responding to the acuity of the job. So, really, the impact of post traumatic stress, I think, are four things that I see a lot, which is difficulty sleeping, irritability and angry outbursts, hypervigilance, and sort of a general intense sort of feelings of overwhelm. And then that can be followed by a feeling of numbness. With difficulty sleeping, and I'm going to sort of detail how this all shows up so that we can start thinking about, well, does this show up for me? How do I experience it? And that's how we really track it. So, like feelings of exhaustion without being able to fall asleep. Sometimes this is a lot of racing thoughts or sort of a lot of intense anxiety. Um, I think a lot of people turn to smartphones and TV to calm down, and I think that's perfectly fine. And largely, I think it works for many. But sometimes it can be too much and it can be hard to unwind and actually fall asleep. Sleep struggles can also result sometimes in interpersonal conflicts, just it can cause irritability. And the other thing we notice is when people aren't sleeping, they end up tending to daydream during the day. Again, daydreaming is not a bad coping strategy, but these are things that sort of take us away from the present moment, and that can make it hard to function. So irritability and angry outbursts also, I hear a lot in my practice with medical providers because again, I want to normalize this. You're dealing with some really high stress stuff with a lot of different people in a really complex system, and it's normal. But sort of sometimes that's overt expressions of yelling or fighting. But more often, it's not so overt, but it's more quiet, passive experiences of feeling like sort of short or clipped responses. And sometimes it's this feeling that there's a tension being created in an interaction. And these things can be very preoccupying to the mind, but essentially you know, their response to anger. And again, as I said earlier, anger is a totally normal and appropriate response to something as scary as losing a patient, or as treating medical traumas, or complex interactions with higher ups or colleagues, or a system that is complicated and at times feels broken. So this is a normal response, but we really need to allow ourselves to acknowledge it so we can manage it and find ways to navigate these spaces. Um, all of this can cause at times difficulty concentrating. So when we're in a state of hyperarousal, it can just be hard to be psychologically present. And the mind tends to sort of disassociate or kind of disconnect from the environment. And it makes it difficult to concentrate and stay present on what's happening. You may find yourself sort of unable to respond to questions or unsure of what happened. And it's important to kind of find a way to focus again. But this is how, when we get really hyper aroused, it's hard to tune into our present moment. And what I'm really describing is hypervigilance. So it's essentially a psychological defense against the fear of being re-traumatized. So what we're trying to avoid is it happening again. And it can lead to sort of a constant state of awareness of one's surroundings, or scanning the environment for clues of the trauma reoccurring. There can be sort of an intense awareness of people and places. And you may find yourself asking yourself a lot of questions. This is sort of the mind trying to avoid something from happening again. And I think that's a normal response when you're dealing, with patients who are passing, especially with the pandemic. You've all seen a lot of that. So I think there's a larger sort of system is probably hypervigilant on some level. Um, People who are hypervigilant, sometimes tend to have difficulty with changes, changes in routine or environment, changes in people around them. And it's easy to get and feel at times jumpy, or kind of like quick to anger. And these are all very common and normal responses to the fear of being re-traumatized. But labeling it for what it is again going to help us learn how to manage it. So the mind, is really working to protect you. This overwhelm, it's a lot of intense feelings at once. And it's a very normal response to sort of repress these feelings, to manage. And I think, repression really works well in the short term. It gets you through the next shift or the next hour or the day. Um, and numbing, something that can be very active. So sometimes we can find ourselves saying, I'm not going to feel this right now. I'm going to move on. And then other times, numbing can be passive. It could be sort of like an automatic neural response to a sort of an unpleasant feeling or experience. Essentially, what's happening is there's so many feelings at once that the brain tends to kind of like short circuit and sort of shut down so you can get through. I'm going to say a little bit more about this because I don't think it's bad. I think that largely people numb, and we all numb, because it's evolutionarily advantageous to move us through difficult and complex situations. However, the numbing of negative feelings and thoughts and experiences can also result in sort of the reduction of positive ones. And this sort of constant emotional repression can lead to the experience of feeling as though you're watching your life at times rather than living it. And we all know that that's not necessarily what we want, but so to really notice that this is happening is important. Although this is a lot of information, I think there are ways to address this and to take care of it. To recap, I really want to normalize emotions. Numbness is a reaction to intense feelings like fear, anger, pain, sadness, frustration, and worry. These are totally healthy human responses to the circumstances and the events of clinical care. Because again, you're dealing with life and death a lot of the time. And so I think what we can do is start to discuss some strategies to help you learn how to manage this. So this last section is going to be on exercises and strategies. I'm going to start with this idea of the window of tolerance. So the window of tolerance is what this basically we're talking to talk about is that when we're triggered, we either move into a hyper-aroused state or a hypo-aroused state. And hyperarousal is all the stuff we kind of talked about around feeling emotionally flooded, reactive, impulsive and hypervigilant, maybe angry or fearful, having a lot of like intrusive imagery and emotions and racing thoughts, flashbacks, that kind of thing. Hypoarousal is when we go numb and we start to feel really flat and sort of empty or sort of cognitively disassociated. This is when we're repressing the overreaction. The window of tolerance is really the optimal space. It's kind of where we wish we could be a lot of the time, where we're not overstimulated or understimulated, where we're both psychologically and physically present. And when we're in that state is really when we can function the best in terms of our cognitive abilities. And the exercises we're going to cover should sort of help you, they're sort of aimed to help you think about moving back into that window of tolerance when you're feeling overstimulated or under. Again, it's always important to reflect on our minds and our bodies and our emotional states to really know where we are, to know what we need to do. Our goal is to really help you both stay in the window of tolerance as much as you can, but so help you kind of expand your own personal window of tolerance. As you spend kind of more time feeling balanced and present, you're going to find that your patient encounters and your encounters with your colleagues, and I think more importantly, your experience of yourself might start to feel more satisfying or meaningful or fulfilling. I'm going to recap before I go into it, but so the three sections of burnout and that we touched on was depersonalization, emotional exhaustion, and low personal accomplishment. And again, these are totally normal responses to the things you're dealing with and to your environment. And reflecting on these experiences and catching them before they become severe is really the goal. The experiences can't be ignored because if we ignore them too much, then they start to become bigger problems like more acute anxiety or sometimes depression. And the best strategy is to catch these problems before they interfere with your functioning, or even if they do, because they do for all of us, catch them and find ways to manage. The first exercise I'm going to really touch on is a self-reflection exercise. So the focus here should really be on the actual feelings of burnout as you experience them. Try and be as specific as possible when checking in with your feelings. So to just say, I'm so burned out, which is what most people say and most systems say, we just kind of go like, oh, it's just burnout. But what does that mean, right? Because it's pretty disempowering just to call it one monolithic thing. We want to understand in what way do you feel burned out and what can you do about it? So I would encourage you to ask yourself, what am I really feeling right now? Am I feeling depersonalization? Am I feeling a low level of personal accomplishment? Or am I feeling emotionally exhausted? And try and find where your experience fits in. And that can help you start thinking about, well, what can I do about that? Um, so when you're experiencing strong emotions, as we all do, it can be helpful to sort of pause for a moment and understand the context. So it can help to just name your feelings. You can say, I feel sad or angry. I had a bad interaction with a colleague or a peer, or I was told I did something wrong and that felt terrible. So name the feeling and then call out the stimulus or stimuli causing the feeling. So try and think back to, well, when did I start feeling like this? What set this off? And sort of connecting the two is going to help you from, it's going to stop the feeling from permeating all of your day or all of your interactions. So if you know, for example, what made you angry or what made you sad, then it doesn't have to carry over into other interactions, and you can maybe start thinking about how to deal with it. And this again is going to help you adjust how you respond. To help sort of with personal accomplishment, this one's hard because I think everybody struggles with this. When experiencing a decreased sense of accomplishment, you want to sort of start thinking about your day, your week, maybe even your month, and think about what went well. It's so easy to think about what didn't go well and get very fixated on the parts of the work that maybe aren't ideal or ways in which we don't feel competent. Here's some statements sometimes you can just try. Like, I felt empowered when my best quality is, my greatest accomplishment today or this week was, and I'm looking forward to, or I helped X amount of people today while struggling through my own shift. I'm going to go move into depersonalization here. So, depersonalization is a sign that you're not tuned in to your own body or mind, or that the two have kind of split off from each other. So, sensory exercises are exercises that can help you get back into the present. It's really a symptom that the mind has wandered away from the present and split off. And so you want to bring it back. And this reconnection to the present should help you maybe disrupt sort of that distant, numb, and at times robotic feeling. So these 5 sensory exercises can help. So in this one, this is just a breathing one that I'm putting out, but it asks you to, take a few minutes and quietly breathe and, count to 5 as you do that. And when you do that, at the end, it's going to ask you to name things you can see, name things you can touch, name things you can hear, name things you can smell, and name an emotion you feel at the end. And the hope is, and the goal is to, as you get back in touch with the present and the environment you're in, it should also start helping you reconnect with your feelings, right? Because a fundamental feature of depersonalization is feeling numb or nothing at all. And so that's why the emotion piece is at the end. And something to try out to see if it helps. Managing emotional exhaustion. So when you're exhausted, again, of course, you want to see how you're actually feeling and doing, and rest if you can. But I know it's not always possible. But the whole premise behind feeling emotionally exhausted is that work or certain things can deplete you. It can take from you in a very deep and meaningful way. And when that happens, you want to find activities and ways to restore or fill your tank up again. And that can look like a lot of different things for different people. For some people, it's by creating things like cooking or making something, building something. For a lot of people, it's by connecting back into their relationships. So, relationships with partners or friends, family members, sometimes colleagues and teams who are going through the same thing. And connecting with them can help normalize the experience and help you sort of feel maybe supported. Of course, things like exercise and meditation can also help, but sometimes doing absolutely nothing at all is what people need. Um, However, I can't say that any one activity is restorative for everybody. So, what you really want to ask yourself is, did I feel better afterward? Did it actually help me? Did I feel more filled up again? Was it useful? I just listed a few other suggestions like sleep. Sometimes we need just sleep, a good night's rest, yoga, nurturing, pets or plants, sometimes even kids, but I know that that's not always replenishing. Taking a walk, at times journaling. I think crying is important. Crying is a huge physiological and psychological release. And I think we should normalize it more and allow space, in the privacy of your own home, if that's what helps, to let some of this out. I think it's a very normal and restorative and replenishing human response. Um, other options are just to kind of talk with friends or connect in relationships, and of course, watch TV. So thank you for listening, and I'm happy to answer any questions and talk with all of you.
Thank you so much for this. This was great. We had so many questions coming through the registration form, so we have plenty to get to. Any that we don't address now, because we had so many, we will follow up post-event so that we can make
Mhm.
sure that we have everything answered while we have you.
Mhm.
So just to start, one of the questions that we had coming through, is
Mhm.
there a way to recognize signs of burnout in men versus women?
That's a good question. You know, I think I think in society, it's often we are still in a society where we socialize men to not express their feelings. So I think we're still living in that reality as much as we're trying to move into a future where we're trying to treat people in a more humane way. So I think often with male patients, it shows up as sort of anxiety that's more quiet and maybe in the sort of presents at home, or it's more concealed. At least that's what I see in my practice. Um, I think it's about allowing room and space for it, but I think the main difference I see is it's less overt and less expressed externally, and maybe a little bit more numb at times as well.
Just as a reminder, as we go through these questions, if anyone has anything they want to bring out while we have Ramya, just go ahead and throw that into the question pane. But we're going to move on to the next one. So, how do you battle burnout if you only have 5 minutes here and there?
Yeah. So I think that's where, I know I emphasized a lot on self-reflection, right? And what I really want to think about here is that, we kind of throw our hands up and we go, okay, I'm burned out. But again, we want to start to think about what that means for you, because burnout looks different in each individual. And so, at least in this presentation, we broke it down into sort of three sections. But ask yourself, well, what does burnout mean for you? Are you anxious? Are you feeling sad? Are you feeling just physical exhaustion? And based on that response, that the answer to that question, then we think about, if it's fatigue, let's say, then we want to think about how to carve out time that, in your off hours, where you can find things that are replenishing or find ways to release that tension. Sometimes that's therapy, sometimes that's friends and colleagues. But it's really about knowing in what way are you burned out, and then finding an intervention that's going to address that, because not every intervention is going to address the thing for everybody. But something that I think can be helpful, if we're just talking about like you're in a shift and you have like a break and you have 5 minutes, doing that breathing exercise that at the end, and connecting back into your mind and body can help you start thinking about ways to help manage this in your off hours. It's really, I think, doing something quick like that can help you ground and recenter again.
Do you have any recommendations for how to discuss topics like with partners or family to help them understand more of what we're going through, what to look for, how to help?
Yeah, I think that's a great question. So I often hear from, medical professionals at large, coming home and feeling just really unable to interact with anybody, and feeling really at times really numb or almost like not really being able to do much of anything at all. And I think, that's that right there is an indication that certainly there's some burnout to that, but I think there's just a sort of feeling really depleted and taken from, and in some ways, sort of it's a reaction to feeling traumatized. So I think what I, often suggest for partners, because that can lead to fights, it can lead to, sort of difficulty connecting with family members, is to tell them, that you might be impacted by work, and to tell them maybe something that can help is educate them on what happens, and how it might affect you. That the work you do is high acuity, it's high stress, and you're dealing with really sort of dire situations sometimes. And of course, it's going to take an emotional toll, and that's a normal reaction. And having that conversation can help families and relationships strategize and come up with a way to help you cope and manage and get the support you need. So often, my patients will go home and they may have come up with a plan with their partner where they need X amount of time after they come home just to regroup and reground in silence or whatever helps them, give them some space, and so that they can come back into their other relationship. Or other times I'll see partners sort of talk together about their needs a little bit more openly and plan and structure their week so that they know what to anticipate from and what to expect from each other.
What's the best way to communicate burnout to your employer?
Mhm. So, I think to so of course, you could say I'm burned out, right? But again, I think what would be helpful is to say that, like, how you're burned out, and how does it feel inside for you? So are you feeling like, one of the, I think, things in burnout that I didn't talk about as much here probably is that, um, it really disrupts how quickly and how well you can think and move and function, because you're kind of like moving through a cloud at times, or there's such a sort of distance and numbness, that your brain can't really, your prefrontal cortex isn't really working that quickly or as fast. And so sometimes it can be sort of explaining that you're feeling so much overwhelm that, and this, explaining maybe what is causing that, that it's you can't function as quickly as you'd like. And I think that is one way to do it. And I think another way is if you have a sense of what you might need. So, do you need, a support in a particular way? So, I think one thing that I've heard has really been helpful in certain programs or hospitals is that, physician groups are starting to talk more openly and directly in planned and structured meetings about how they are impacted by the work and how they're impacted by the system. And having that social connection with each other and being a little bit more open and facilitating that can, first of all, break up the isolation and loneliness of having to go through it alone, and also help you get connected with one another, in a deeper way.
What are the next best steps to take alongside practicing these skill sets? Would you agree or disagree that seeing a therapist on a routine basis would be beneficial?
I think it would be very beneficial for, a lot of people actually, because again, I don't think we acknowledge that practicing medicine means you are dealing with life and death. And that means that consciously it's affecting you in certain ways, but more unconsciously, it's putting you in a state of some amount of hypervigilance because you're trying to really care for people who are sick. And that's going to stir up all kinds of thoughts and feelings. And I think therapy can be very supportive, and also help you work through that experience. And as you do that, I find a lot of patients really tend to enjoy their work more. Often, when we're carrying so much and we're so burdened, we can't really enjoy our work, and that carries through long term in something like medicine. So I really think that, getting therapy in a regular way can help you work through those feelings and thoughts and kind of reconnect with the deeper purpose and meaning of your work.
We had a question come through our chat just now. How do you avoid retaliation and how do you protect residents and medical students so they feel safe to express their feelings?
Mhm. So, do we mean like retaliation from the system, like retaliation from, do we have a sense of from where?
I'm going to let Miriam comment on that if she can.
Mhm.
So maybe we'll give her a minute. Do we want to go on to the next question, see if we can get a little bit more addressed there? We'll come right back to that, but to give you some time to respond to that, how would you say that junior residents, how can they be mentored by senior or chief residents to recognize burnout and promote a work culture and self-care?
Mhm. What I think would be very helpful. So I see a lot in residency programs, especially that sort of there are these wellness in initiatives and things that I think are more behavioral, like you know sort of social outings or like doing yoga and things like that. And I think those things are helpful because they promote social connection. But what I think is would be more helpful at times, or what I really wish would happen is that if through the, I know that there are many like clinical learning hours that are required. And in those moments, if there were sort of structured ways to start talking about as a group what the experience is like, what are people struggling with? And if there was a way to facilitate more of a conversation or a dialogue. I've seen some programs implement like a form of a group therapy where they might bring in a consultant or a therapist who helps facilitate that conversation to help create some psychological safety so that people can start talking to each other about what's going on. The primary thing I see with my medical professionals who come in for psychotherapy is that they are lonely. They're all going through and dealing with really intense, high acuity things. And especially during the pandemic, seeing the amount of patient loss that people have seen is very overwhelming and intense. And I find that it's not safe. It doesn't feel like you're allowed to talk to each other about the impact of that on yourself. And I think it would be nice if there was a way to facilitate, if chief residents or attendings, if these programs would take some initiative to sort of start thinking about like, how do we talk about this together? And how do we find, maybe you find a consultant or therapist in your area that will help facilitate that conversation in a group format, once a month or something. And I think that I have found, programs where they have done things like that, it seems to be helpful.
Awesome. So we're going to step back to Miriam.
Mhm.
It looks like we had a little bit of commentary on her part. So let's just go back to the question that states, how do you avoid retaliation?
Mhm.
How do you protect residents and medical students so they feel safe and express their feelings as it pertains to the system or faculty?
Mhm. Yeah. So when you say retaliation, my mind wonders if it's like, for example, if someone needs to go to therapy regularly at the same time every week, or they need accommodations in certain ways, will they then be knocked in some way professionally? And I think that certainly does happen in systems. This is such a tricky question because it's like, in my view, because I'm a psychotherapist, I really think about promoting agency of the individual. And in doing that, that in my view would be to give voice to that experience and sort of call it out that this is problematic, that somebody can't take that somebody can't get the care they need because they are providing care, right? Um, and call out how that does create sort of a toxic system that creates unrealistic expectations. However, I also recognize that if you're in a system where you're worried about retaliation, that tells me already that the system is not safe for anyone to call it out, probably. Um, but I do think so that means that, there are larger systemic issues that may not always be easy to navigate from an individual level. But I do think that the more there can be open dialogue, the more we can increase the voices of residents and resident directors and attendings, the more that you have medical professionals speaking out together in some form. And I think the more that the systems start to realize that there has to be some form of change. In these situations, I always think there is safety in numbers. So if you have a group of medical providers in your hospital system that are willing to kind of have this conversation together, then then you're more likely to get the system to listen and not target any one of you individually, and sort of attack you. So that's how, that's my sort of quick sort of response to that. But systemic issues are, in medicine, they're baked in, right? And they're baked into all kinds of issues we have with managed care and insurance and 8 million other things. And so, yeah, this is an uphill battle, but I think it really starts with us starting to talk more openly and directly about the impact of this really important work, on people's minds and bodies.
Since we're wrapping up on time, we have one more question. So do you have any tips on dealing with race-based comments or assumptions in the workplace, particularly aggressions or microaggressions from patients as it pertains to burnout?
Yeah, this is so important and a much needed discussion, and I feel like actually a whole other talk. Um, Let me think. In terms of, you know, microaggressions are huge, and I think there's a lot of racism in our country and everywhere, but certainly in medicine. And I think it can be hard to feel safe, especially, for physicians and medical providers of color based on who's in their cohorts and who's in the system, because even talking about that may not always be received in a safe way. So, with the few minutes we have, I think this could be a whole other thing, really. But what I would think immediately is ask yourself where you actually do feel safe to even start talking and thinking about the impact of that. And sometimes the answer might just be in other relationships or in therapy, because every system is different, and you know giving voice to these things that don't have voice is really how we can shed light on the problem. Until we can do that, then the problem doesn't exist for the system and it doesn't exist for the people in it. So the best way to do it is to give voice to it in a place that feels like safe enough where you can feel heard. But it is real and it does happen. And I think people will try and convince you that it doesn't, but it's absolutely real.
Thank you so much. We're right about time. I know we have so many additional questions that want to be answered. So like we said before, we will get to those post-webinar in an FAQ or through email. We'll be able to answer everything that we had come through. Some of the topics we noted were, so large that we would just want to be able to add on to a whole other session. So luckily we do have Ramya a couple more times. We have recordings coming on different topics that you should have received in the email. So we look forward to being able to invite her back in the next couple weeks. So once again, thank you so much, Ramya, and thank you everyone for attending today's webinar. If you have any questions at all that come to mind after this, please feel free to reach out to webinars@TrueLearn.com, and we will be able to get those over to be answered and sent back. You will also receive a follow-up email within 24 to 48 hours of the actual recording should you like to rewatch or share it out. And on behalf of TrueLearn and our presenter, thank you all so much for joining us and have a great rest of your day.
Thank you. Thanks for having me.